Roofers, beauticians, bar staff and waiters, the least likely people in this country to be vaccinated. Any thoughts on why?
Yeah, I think there's a few factors here, Kev. There's with some of the bar staff, you're looking at probably generally they're younger. So when you look at the pandemic, we've talked in the past, I think about this, it's clearly a pandemic that affects the elderly. So many bar staff will be thinking, oh, well, I'm younger. I don't need to have the vaccine. But I think the roofers thing, you've probably hit the nail on the head. They're outdoors. They're probably thinking, well, I've gone the first from March all the way until the vaccine's kind of been introduced. I'm fine. And you might find, Kev, as well, the same thing there, especially if you're younger, that if you're kind of a beautician or you're a bar member, staff kind of thing, and you're working indoors, they might have thought, well, I've been working indoors quite closely from March all the way through to January when we had the March with the start of the pandemic. January is when the first vaccines come on board. They might be thinking, well, I've caught COVID myself. Why do I need a vaccine? So there's probably a wide range of things because the evidence is quite clear now, Kev, is coming out that people who've had COVID, it's clearly you've got some kind of natural immunity from all of the pandemic as well.
So those professions that come into close proximity with other human beings, as we were just discussing, like beauticians, bar staff and waiters, they're probably the most likely people to have caught COVID probably quite early on, and they've kind of concluded that they have antibodies and maybe don't need it. Maybe that's the reason.
Yeah, possibly. So I've had two vaccines myself, Kev, but then I had the Delta variant. It seems quite old now, the Delta variant, because that was the one where you
That's
lost your
very
taste and
unfashionable,
smell.
Jamie. We're on to the
It is
Omicron now. That's last year's thing.
indeed. No, I had the Delta variant. I feel sorry for all the people who get Omicron, not in a kind of a bad way because you don't want to get it, but you're never going to lose your sense of taste and smell, and that's kind of a weird thing, Kev. But yeah, so I had that variant. I've had two vaccines. I was invited in for a booster, and I thought, do I need a booster? I'd rather my vaccine goes to people kind of in the in the kind of the developing countries who can't afford the vaccines at the moment. So I think you've probably got an element of that. There's an element of people who've also caught caught COVID, Kev, people who've actually a bit younger and they know the relative risk is quite low. So I think there's an element of a few different things. That's probably why you get these. And then when you start looking, Kev, at the occupations where they're mainly vaccinated, obviously healthcare workers come in, and then obviously it kind of shines a light on the fact that the mandate for health workers, well, we've got significantly more people, Kev, who've had the kind of the COVID vaccine over and above people who had the flu vaccine, and we've never mandated the flu vaccine in the past either.
Although Jeremy Hunt seems to be indicating that he quite likes the idea of mandating the flu vaccine. I don't think you should mandate any vaccines in any circumstances, either across the country or in terms of professions, or as in the NHS. But that's a different issue. How are we standing statistically right now, Jamie, in terms of the COVID crisis? My impression is death rates are going down. The hospitals aren't being overwhelmed. The number of cases are looking good. What's the situation?
Yeah, Kev. Well, it depends where you look. If you look at the Sky News Twitter feed
Oh
this
yeah, we'll all
evening,
be dead next week.
yeah, well, you'll be dead by next week. And they're saying record deaths recorded today or announced today since February. Let me just explain what that is. So what we've seen, Kev, is that we've had a bit of a backlog because the UK Health Agency have changed the way they've done some of the stats. You get that. And also because like millions and millions of people have been catching Omicron, we know now that more people are going into hospital with Omicron, but they're not actually in hospital because of Omicron. So when you think about it, if say yourself, Kev, you imagine you felt, you caught Omicron and you was fine with it, you might break your leg, go into hospital, you'll be included in the stats. So where we are overall, the good news is the number of patients on ventilated beds in intensive care has been coming down significantly. Over the last month, Kev, we've seen a rapid rise now in the number of patients in hospital with COVID, but not because of it, which kind of shows the fact that people are just catching it, but they're not going in because of the virus. And deaths, even though kind of some Sky News and some other outlets are saying the highest number of deaths reported today since February, actually, when you start looking at the facts and figures, deaths haven't moved significantly much at all. And when you start thinking that Sage was saying that the deaths around now would be kind of significant numbers per day.
Well, they were saying 6,000 a day by mid-January.
Yeah.
We didn't really get anywhere near that, did we? What is it now at the moment? 300, 250, something like that?
Well, when you start factoring in the number of deaths that are purely down to COVID or maybe linked slightly to COVID on the death certificate, Kev, it's probably running around 200. So, they were talking about 6,000, 4,000, 2,000, depending on if you look at the more pessimistic or the more optimistic view. But it's quite clear now, Kev, that the SAGE modelling that I think Michael Gove this morning on Julia's show was apologising because he was pushing for more restrictions over Christmas. And remember, we had them in Scotland, we had them in Wales. At least Michael Gove's had the balls to come out and apologise for pushing for more restrictions that Boris and Rishi Sunak pushed back against. The devolved countries didn't. And the facts are, Kev, we got nowhere near what the predictions were coming out. And the problem you got there now is that in the future, we say we get another variant. Now, naturally, the way the virus generally works, Kev, is you get new variants become more transmissible and less deadly. But imagine you got a scenario where we get a more deadly one. People are going to question any SAGE scenario. It's going to become the boy who cried wolf kind of scenario.
You're a statistician, Jamie. You've followed this COVID crisis through the prism of your expertise. You must have concluded at an early stage that basing public health policy on epidemiological predictive models was a kind of madness.
Well, I think you had to have some models at the start, but then Neil Ferguson came out with those absolutely bonkers policies when with probably predictions when you come look back on them now about how many deaths there would be. In September, Kev, we went in and they said that if you don't bring in Plan B, remember Plan B came in just before Christmas, which was the vaccine passes and kind of the work from home. They said in September, Sage, if you don't bring in Plan B, we'll get between 3,000 and 7,000 hospitalizations a day. What did we end up with? 700. I think, Kev, that was the point where Boris and the rest of the cabinet, or some of the cabinet, thought, well, why should we believe them when we went into Christmas?
Yeah.
And yet, you kind of bang on the money there, Kev. We can't live our lives on models that have clearly been kind of true throughout the pandemic.
I don't know if you saw, there's a story out today about a report kind of incorporating global research by the Johns Hopkins University in America. And they kind of assessed the efficacy of lockdowns all over the world. So it was a global report. And basically, they said that the lockdowns didn't really achieve anything in terms of death rate. That if anything, maybe the mortality rate was curtailed by about 0.2%, and the border policies only curtailed mortality by 0.1%. In other words, they said that lockdowns really didn't work in terms of containing the virus, stopping the spread, stopping people dying from it. Does that concur with your observations in terms of the statistics? That have we in Britain effectively, and other countries that locked down, ended up in the same state as somewhere like Sweden that never did lock down?
Well, Kev, it's going to depend on where you are. So let's start off with Australia and New Zealand. So they've had probably some of the most draconian restrictions across the world, and they kind of kept out those earlier variants. So they would argue now, Kev, that if Omicron's the one, because you see the cases in Australia over Christmas and New Year, they absolutely exploded. So they've had this zero COVID policy. They said, well, we can't continue this forever. So if Omicron is the virus that really spreads across the country, they're probably going to get less deaths. But that's more of an extreme example. What I said in the past, Kev, is that what you tend to find with lockdowns is, okay, if you've got a point where the NHS in the UK or other health systems across the world will become overwhelmed, where people would die if they don't get any treatment whatsoever, and we didn't never reach that point in the UK. Let's make that point. That then makes sense for a lockdown. But all a lockdown does, Kev, is it's exactly like watching a movie on Netflix. You press pause to go make a cup of tea or pour a glass of wine. You come back in, you press pause, play again, and then you carry on because the virus doesn't go away. So people who would have been infected, if you lock down for, say, 4 months, they'll get infected 4 months later. And if they were vulnerable then, they'll be vulnerable kind of 4 months later as well. So overall, the lockdowns, we really need to look back now on these policies and think we've got loads of evidence now from this pandemic.
Yeah.
Should we lock down again? I don't think so.
No, I don't think so either. And don't forget, they had terrible effects socially and economically as well. So I think overall they did a lot more harm than they did good. And I don't think they did any good at all. Jamie, fantastic to talk to you. Thank you very much.